Pop quiz number 80. The nurse cares for an older adult client who is insulin dependent and lives in a long-term care facility. What intervention is most appropriate for the nurse to add to the client's care plan? 1. Encourage the client to use an electric razor. 2. Have a podiatrist cut the client's toenails. 3. Soak the client's feet twice each day. 4. Advise the client to use deodorant soap when bathing. And guys, the correct answer is choice number 2, have the podiatrist cut the client's toenails. So whenever you're being asked about a most appropriate measure or a priority, you always need to think about safety. What's going to keep your patient alive the longest? What is going to protect them from harm? Remember, this is a diabetic patient. Often they have peripheral neuropathy. Guess what? As the RN, you cannot cut that client's nails. You can't cut the toenails, right? They're elderly clients, so their vision may be decreased. We don't even want them cutting their own toenails because they're also at risk of infection because of the high glucose level. So we want a podiatrist to cut it. That is the only answer out of all these choices. I mean, the other choices are all okay, but choice number 2, that's the one that's going to protect that patient from injury, and so that's why it's the correct answer choice.